Hi, I want to welcome you back and Happy New Year. I also want to update you on the situation we're facing right now. You're probably aware that the pandemic is increasing and has not been brought under control. And in fact, in San Diego, we're seeing a significant surge. We have not seen a plateau or a decrease in numbers. They continue to rise. We're also seeing this rise in our community throughout California and San Diego in our student population as folks return to campus and as well as for those that have been living on campus throughout the winter break. So I want to take this time to really reinforce how serious the situation we have right now. Winter quarter is very different than fall quarter. While there is great news ahead that the vaccine is working and being distributed and production will increase and eventually be distributed and will in time reach the student population, we are far away from that point. Right now, we're seeing a rate of virus that is concerning. When we came back in the fall, students, the undergraduates coming onto campus, had a positivity rate of 0.1%, meaning 1 in 1,000 students were identified to be carrying the virus. Unfortunately, we're seeing a much higher rate now. The combined rate for students on and off campus and the testing we've done since the new year is about 1.8%, not quite a 20-fold increase. We're also seeing similar numbers in the San Diego community. So we need to double down on what we are doing. We need really strict adherence to the masking and the distancing and the testing protocols. So I want to go over those things with you again, just to make sure you understand the strategy and the need for you to help us as we try and manage this current surge of viral activity. This is a virus that from exposure has a variable onset for the individuals who acquire the infection. The onset may begin within 2 days, but it may not begin for 10 days. And the symptoms may be minimal, none, or quite severe. So variability of symptoms and variability of onset makes this particularly challenging. But if you understand that, you'll understand the strategy that we've laid out for testing. So for folks who are arriving onto campus, we want you to test within 24 hours. We also want you to test on day 5 and day 10. During this period, we also want you rigorously adhering to masking and distancing. Please don't be reassured that a test on day 1 means you didn't acquire the virus from whatever activities you were involved in over winter break. We are seeing a number of students who are getting a second test on day 5, because we're now at that point, who are now positive, even though their first test was negative. We're also seeing students who are arriving and not getting that test right away. And so they're getting their test 3 or 4 days later. Unfortunately, in some of these situations, the students are not continuing to mask and they've exposed other students. So we have a number of students who are in quarantine. So please, if you've been off campus coming back from winter break, test within 24 hours arrival, test on day 5 and day 10. If you leave campus and are involved in unmasked activities for whatever reason, please realize you've created some vulnerability to exposure and acquiring the virus, and you need to test on day 5 and 10. That will be true throughout the winter quarter. After your arrival and you completed your test on day 1 arrival, 1, 5, and 10, then you need to move to weekly testing. So remember, during the winter quarter, we'll be testing all students who are living on campus or coming to campus for any reason on a weekly basis. The chancellor has actually done a nice challenge for us. For all students who test every week and comply with the requirement, there will be a $50 donation to the Basic Needs Fund. So please help your other Tritons. Comply with the testing, take care of yourself, and help your other Tritons. So I want to go over again. Please do your daily symptom screener. Please mask. Masking is critically important in all settings. Distance. If you want to spend time with others, do it outside and do it with significant distance. We also have this new viral strain in San Diego, which is more easily transmitted. So all of these efforts become even more important to reduce the chance of transmission. So please test regularly, follow the testing schedule on off campus when you return to campus within 24 hours arrival, day 5 and 10. If you leave campus for unmasked activities for whatever reason, test 5 and 10 days later. Then move to the weekly testing process. Do your daily symptom screener. Also, if you are living in residential housing on campus, you should not be moving between suites. You should stay in your own suite area. And for now, we want you to mask and distance within the suites, particularly in these first few weeks till we stabilize the situation. We will continue to give more updates as the situation evolves. You guys did a phenomenal job. The students were critical to the success of fall quarter, and I want to thank you for all those efforts. But it was that adherence to the good behaviors and the testing protocols that gave us a very safe campus and allows us to continue. We are now facing the challenge of the community surge. We need to stabilize the campus, and we need to get back to that very good situation we were in the fall with a very low level of viral activity within the campus community. So thank you again in advance for all of your efforts. We really appreciate it. You are the critical element of the Return to Learn success story.